Welcome to the session on systemic pathology, presented by Dr. Hiteshwar Yadav, PhD in pathology from ICAR Ivory, and part of GNP Sir classes. The digestive system can be affected by various malformations, caries, and stomatitis. These conditions can lead to significant health issues in animals. Tumors of the mouth, pathological conditions in salivary glands, and esophageal choke are common issues in animals, each with distinct symptoms and treatments. Rumen, reticulum, and omosum disorders include ruminal tympany, abomasal displacement, and gastritis, each affecting the digestive efficiency of ruminants. Liver conditions such as telangiectasis, regeneration, biliary hyperplasia, and cirrhosis can severely impact an animal's health, leading to various systemic issues. Jaundice, characterized by yellow discoloration, can be caused by different types of bilirubin imbalances, each with specific diagnostic parameters. Intestinal issues like atresia, Meckel's diverticulum, and volvulus can cause severe digestive problems, requiring prompt diagnosis and treatment. The nervous system can be affected by spasms, tremors, epilepsy, and paralysis, each presenting unique challenges in diagnosis and treatment. Injuries to nervous tissue can lead to shrinkage, swelling, and chromatolysis, with various cell types like astrocytes and oligodendroglia playing crucial roles in response. Congenital anomalies such as amyelias, craniostenosis, and spina bifida can significantly impact an animal's development and quality of life. Musculoskeletal system disorders include conditions like amelia, micromelia, and scoliosis, affecting the limbs and spine of animals. Skeletal system pathologies such as rickets, osteomalacia, and osteoporosis can lead to weakened bones and increased susceptibility to fractures. Urinary system disorders include ectopic kidneys, renal aplasia, and renal cysts, each affecting the kidney's function and overall health. Errors in renal function, such as proteinuria, hematuria, and nephrosis, can lead to significant health issues, requiring careful management and treatment. The hematopoietic system can be affected by various conditions like hyperchromasia, target cells, and Heinz bodies, impacting blood cell function. Blood cells, including erythrocytes and leukocytes, play crucial roles in the body's immune response and oxygen transport. Erythropoiesis, the production of red blood cells, is a complex process involving the bone marrow and kidneys, crucial for maintaining healthy blood levels. The development pathway of red blood cells from stem cells to mature erythrocytes involves several stages, each critical for proper blood function. Anemia can be classified into regenerative and non-regenerative types, each with different causes and treatment approaches. Regenerative anemia, caused by hemolysis or blood loss, requires specific diagnostic and treatment strategies to manage effectively. Non-regenerative anemia is a condition where the bone marrow fails to produce enough new red blood cells. It can be caused by nutritional deficiencies, chronic diseases, or renal diseases. Red cell morphology varies with different types of anemia. Acute blood loss shows normocytic, normochromic cells, while chronic blood loss may show hypochromasia and microcytosis. Hemolytic anemia often presents with spherocytosis, and non-regenerative anemia shows normocytic, normochromic cells. Neutrophils are a type of white blood cell crucial for fighting infections. Immature neutrophils, known as band neutrophils, are recently released from the bone marrow. Mature neutrophils circulate in the blood for 10 to 12 hours, while old or senile neutrophils are hypersegmented and remain in the blood for more than 12 hours. A left shift indicates an increase in immature neutrophils, often due to inflammation. A regenerative left shift shows more mature neutrophils, while a degenerative left shift indicates a poor prognosis. A right shift, with increased hypersegmented neutrophils, can be due to stress or glucocorticoid treatment. Various skin conditions can affect the epidermis, including acanthosis, dyskeratosis, and erosion. Other conditions like wheal, hyperkeratosis, and macula also impact the skin's appearance and function. Skin anomalies can be inherited or acquired. Conditions like epitheliogenesis imperfecta, hypothyroidosis, and folliculitis affect the skin structure and function. Other anomalies include cysts, dermatitis, and neoplasms. Eye conditions can range from aphakia, the absence of the lens, to retinitis, inflammation of the retina. Other issues include cataracts, glaucoma, and conjunctivitis, each affecting vision and eye health. Ear conditions can include congenital issues like macrotia and microtia, as well as infections such as otitis externa and media. Trauma and inflammation can also affect ear health, leading to various symptoms and complications. The respiratory system can be affected by conditions like rhinitis, pharyngitis, and tracheal collapse. Brachycephalic airway syndrome and laryngeal hemiplegia are also notable respiratory issues in certain breeds. Pathological conditions like guttural pouch empyema and kennel cough can severely impact respiratory health. These conditions are often caused by infections and can lead to significant complications if untreated. Chronic obstructive pulmonary disease, COPD, in horses, also known as HEAVS, is characterized by respiratory distress and poor air exchange. It is often caused by inhalation of dust particles and allergens, leading to inflammation and airway obstruction. Pneumonia progresses through several stages, from congestion to resolution. Each stage involves different pathological changes in the lungs, affecting their function and the overall health of the individual. Bronchopneumonia and interstitial pneumonia are two main types of pneumonia. Bronchopneumonia is often caused by bacterial infections, while interstitial pneumonia involves inflammation of the lungs' interstitial tissue, often due to viral infections. Pneumonia can be classified into several types, including embolic, granulomatous, verminous, and aspiration pneumonia. Each type has distinct causes and pathological features, affecting the lungs differently. The cardiovascular system can be affected by congenital conditions like patent ductus arteriosus and atrial septal defect. These conditions impact blood flow and heart function, often requiring medical intervention. Pericardial diseases, such as hydropericardium and cardiac tamponade, involve the accumulation of fluid in the pericardial sac. These conditions can lead to severe complications, including impaired heart function and death. Myocardial diseases include hypertrophy and myocarditis. Hypertrophy involves an increase in muscle mass, while myocarditis is inflammation of the heart muscle. Both conditions can significantly affect heart function. Endocardial diseases, such as valvular endocardiosis and mural endocarditis, affect the inner lining of the heart. These conditions can lead to severe complications, including heart failure and systemic infections. Cardiac failure can be classified into left-sided and right-sided heart failure. Each type has distinct causes and symptoms, affecting different parts of the body and requiring specific treatments. Neoplasia refers to abnormal and uncontrolled cell growth, which can be benign or malignant. Understanding the characteristics and progression of neoplastic changes is crucial for diagnosis and treatment. Epithelial tissues can give rise to both benign and malignant tumors. For instance, skin can develop squamous epithelial cell carcinoma, while the upper alimentary tract may form squamous cell carcinoma. Understanding the origin and type of cells involved is crucial for diagnosis and treatment. Mesenchymal tissues, including connective tissue, bone, and muscle, can also develop various tumors. These range from benign fibromas to malignant fibrosarcomas. Recognizing the tissue of origin helps in identifying the type of tumor and its potential behavior. The concept of latency or latent period explains the time before a tumor becomes clinically detectable. Tumor invasion and metastasis involve complex mechanisms, including epithelial mesenchymal transition and intravasation, which allow cancer cells to spread to other parts of the body. Neoplastic transformation involves the stepwise alteration of normal cells into tumor cells. This process includes initiation, promotion, and progression, leading to the development of malignant tumors through genetic and epigenetic changes. Grading and staging of tumors are essential for determining the severity and spread of cancer. Grading assesses the differentiation of tumor cells, while staging evaluates the extent of tumor growth and spread, aiding in treatment planning and prognosis. Thank you for your attention. We hope this presentation has provided valuable insights into the origins, development, and classification of tumors.